Thank you all so very much for joining us today, and welcome to Radio One's Children's Vaccination Campaign. I am Melissa Wade in the Water, Radio One, the Light 103.9. Now, we all know that COVID-19 vaccinations are now available for our kids, our children, those 5 to 11 years of age, and vaccinations are a tremendous breakthrough against the pandemic. But there's still so many questions to be answered, especially now that our kids are getting vaccinated. So here to answer some of those questions today is the Health Director of Durham County Department of Public Health, Mr. Rodney Jenkins. Mr. Jenkins, how are you doing?
I'm doing well, Melissa. Thank you so much for having me. I'm a fan of the station, and I'm so grateful to be here.
Well, thank you so very much for joining us with all this wonderful information that I'm sure everyone, especially our parents, are wanting to know more about this. Well, we of course know the holiday seasons are right here amongst us, and that means, our normal. We're kind of back to, I won't say a total norm, but getting together with family and friends is something that we are looking forward to. We're excited about. Tell us, what is the importance of vaccinating our population, those 5 to 11 years old, our children, making sure that they are vaccinated before the holidays? How important is that?
Hands down, Melissa, it is critical. It's not only critical, it's life-saving, and it's very necessary. Make no mistake about it, ladies and gentlemen, our children continue to be, at this point, our most vulnerable population. Mm-hmm. Until last week, the only way that we could protect our children was to ensure that we, as adults, got vaccinated and continued to employ tried and true public health mitigation strategies, i.e. the 3 W's. Durham County overall has been successful as far as our vaccination efforts. At present, we have vaccinated over 72% of our eligible population. Mm-hmm. We want this holiday season to be much better than it was last year. Last year, there was a lot of separation, there was a lot of quarantining. You could not simply go to Big Mama's house because you did not want Big Mama to get infected with COVID-19. As mentioned, last Thursday was when we got the green light, and we have been successful thus far as being able to vaccinate children. We want families to be together without fear of infections. We certainly want them to be able to come together in the spirit of holidays and fellowship. But of course, the only way to accomplish this is through vaccination. So I'm encouraging everyone who's eligible to get vaccinated so we can have a fantastic holiday season.
I love it. And I love Big Mama's house. I'm telling you, it says good smelling food, good tasting food, and everything. Big Mama's house.
I'm looking for that sweet potato pie. I'll tell you that.
I know that's right, Mr. Jenkins. But of course, we're talking about the holidays, and when we're talking about vaccinations for us, we're like, okay, us, we can get it, we're fine. But now we're talking about our kids. What are the health implications for the country overall if our children are vaccinated at a lower rate than the rest of the children in other countries?
We know, Melissa, that the recent surge in COVID-19 cases due to the Delta variant had an enormous impact on our children. Mm-hmm. During the most recent surge, which we're slowly, continuously getting out of at present, the Delta variant really wreaked havoc on pediatric cases. In fact, they rose at about 240% in the United States, along with hospitalizations and serious illnesses among the age group, which are pretty much our children. Mm-hmm. We also learned, Melissa, that this thing called long COVID, in which people who get infected have continuous side effects and implications due to COVID. We do know that young people suffered those devastating effects for months after first testing positive. COVID-19 vaccines, again, are the best way to protect our children now and in the long term. Simply stated, this county, this great county that I work for, it's still susceptible to pockets of infections if we're not able to vaccinate all who are eligible. And at present, kids who are 5 to 11, they have the tremendous opportunity to get fully vaccinated right before Santa comes.
That's good. That's good. And to mention, you say the area of where you are. I'm from Durham as well, so I like to say I'm a Durhamite. And we know there are certain areas. Are there health equity implications if families from, so to speak, historically marginalized communities are vaccinating their children at a lower rate?
Absolutely. I am proud to say that all of our reporting, all of our planning, all of our deliberations have been executed with a careful eye on racial equity. We believe that, and we are committed to ensuring that all of Durham has access to that critical, accurate information that helps keep them safe. We've been committed to this since the pandemic began. We've not wavered from it. We work with many partners, Melissa, to ensure that vaccines are distributed in a fair and fast manner. And I'm going to do some shameless name dropping, but we partner with Duke, the African American COVID-19 Task Force Plus, Latin 19, El Centro Hispano, La Familia, Durham Tri, Durham Public Schools, War for Life, Chapel Pediatrics, and many, many others. I'm pretty sure I'll get in trouble for leaving somebody off. But these people, these organizations have been so instrumental in making sure that every demographic in Durham has been able to really be in service, get the attention that they need. And I'm just so proud to partner with them. But again, we want to make sure that we take a close look at all the census tracts, all the social vulnerability indexes. We want to make sure that every nook and cranny of Durham is taken care of. And I'm proud to say since December 22nd, 2020, since we began our vaccination campaign, there's not an area of Durham that this health department has not been to.
Oh, that's absolutely wonderful. I commend you all and all the organizations, even the ones you've been out. That's great that you guys come together to make that happen. Now, we know, to mention grandma, big mama, we know how, they're usually the ones are kind of the caretakers of the smaller kids. And if the kids come into the house with a cold, 9 times out of 10, grandma, big mama will do it too. So how can the health of our children impact the larger health of our community? Just taking it out of the house and making it the entire community.
Indeed. One thing that I've learned in my years in healthcare is that health is wealth. We cannot profess to be a healthy and a vibrant community overall if our children are unhealthy. Simply stated, we owe it to our next generation to ensure that they're off to a great start. And Durham is fortunate. We have many resources that assist parents and caretakers with keeping their children healthy. And, it's no surprise that this is considered to be, and is affectionately called the City of Medicine. From the Durham County Department of Public Health to Duke to Lincoln Community Health Center, and all practices in between, we stand ready and prepared to take care of our pediatric population because we know, again, if the children are healthy, then, we have a healthy community. And as a father, I will say this, as a father, there's nothing like your children checking you like, oh, Dad, are we going to go walking? Or are we going to eat some salad? Again, is that trickle effect that we are also seeing with vaccinations. Kids are coming to get vaccinated, and they're bringing their parents too. And they're making it a family affair. And that does my heart a whole lot of good.
Oh, that sounds great. That is, kids will look at you with those big eyes and say, come on and get it. You're not going to be safe unless you do. And yes, by any means necessary, whomever, whatever we need to use. You're absolutely right, Mr.
They keep us very honest. No doubt.
Yes, they do. Yeah, amen to that. So look, what are some of the ways, and I think you've kind of mentioned on and off, that the county is supporting pediatric COVID vaccinations?
Oh, my goodness. I think the question is, what are we not doing? As mentioned, since December of last year, mass vaccination clinics at the Durham County Department of Public Health has consistently vaccinated Durham's residents. With every new wave, Melissa, we retool our operations and prepare for the newest eligible population. Of course, right now, we are able to vaccinate our pediatric population who are ages 5 to 11. I'm proud to say my team has retrofitted our operations, and it's a very warm and welcoming environment for children and their parents. But, as mentioned previously, we partner with so many trusted community partners that care and are committed to our children and our community overall. One of the major ones, of course, is Durham Public Schools.
Mhm.
We have a fantastic partnership with them. Of course, school health nurses in Durham are actually public health employees. So again, that extends itself to that. As mentioned, War for Life, Latin 19, La Familia, many pediatric practices. They all care about our children. Um, to really drill down, Ms. Melissa, we've held two town hall events to educate parents and students about the pediatric vaccine and to address their questions because there are a lot of them out there. We were able to follow up on these town halls with a mass vaccination clinic that is set for November 13th, this Saturday, from 10 to 3 p.m. at Hillside High School. It's similar to what we did in the spring, where we kicked off some vaccination campaigns when kids 12 and older were able to get vaccinated. So we just kind of thought it not robbery to go ahead and repeat and do it again. We provide all vaccinations free of charge, but of course, our primary focus at present is pediatric vaccination. So again, as we mentioned before, we hope to make this a family affair. It's on a Saturday. It's coming off a couple of days of rest and respite. And we certainly hope everybody under the sound of my voice will consider to come and make it a family affair and get vaccinated all together.
Absolutely. I'm so proud of my city. I tell you, I love it. I love
Hey,
this.
Bull City, stand tall.
Absolutely. So, Mr. Jenkins, except for the children who are younger than 5 years old, now everyone it pretty much is authorized for the use, everybody 5 and older, to get vaccinated. In terms of the pandemic, what is your hopes for the health of our community moving forward?
I'm hopeful that we will continue on this trajectory upward. I believe in Durham County. I have seen the very best in our residents, from mask wearing to standing in line to get sometimes long lines, Ms. Melissa, to get their vaccinations. And my hope is that we will be able to continue these positive trends. I hope that we will able to vaccinate our children in large numbers on a really consistent basis. I mean, the vaccine is here. There's no shortage of vaccine. You have ready and willing partners, not just your traditional pediatric or medical practices, but we have partners, big box pharmacies like CVS, like Walgreens, like Kroger, who offer vaccinations at non-traditional hours. Honestly, I really hope that Durhamites like yourself and many others will continue to seek evidence-based, accurate information, and not necessarily look to social media for answers, but really look to the experts who can give you that information that you really need to go run tell that. I am certainly hopeful that, again, those who are eligible for the boosters will consider getting their boosters. And very soon, hopefully very soon, toward, maybe the spring of 2022, we can really, really start getting back to the get down that Durham is used to, these festivals and these special events. And we can really, really enjoy the Bull City like we've always done.
Absolutely. With all the changes that's happening downtown, I just love going to walk and just check out everything that's happening. So I'm with you. I'm ready for it to open back up. So if I can get a little personal with you right now, of course, everyone's saying you're talking about children and the vaccinations. I'm still kind of skeptical. So what if it was you? So my question for you, Mr. Jenkins, is I heard you say you're a dad, so I know you have kids. Do you have any between the ages of 5 and 11? And if so, if you don't mind me asking, are you going to get them vaccinated?
Absolutely. I am the proud father of 2 beautiful kids, and I do have one, my namesake. We affectionately call him Rodney. And Rodney is prepared to get his vaccination this Saturday at the event that's being sponsored by Durham Public Schools. He is 10 and a half years old, so he's most certainly eligible. I do have my beloved, beautiful daughter who is 4, so she's not quite there. But I'm pretty sure when she sees Big Brother rolling up his sleeve and being a big boy and getting his vaccinations, that she's going to want to do that as well. But as your public health director, I would not be genuine. I would not be a man of my word if I did not really extend what I'm preaching and pontificating to my own family. So, of course, Melissa, I got to check in with mama first. So, my wife,
Lord help you if you don't.
I'm here to tell you.
Yeah.
I'm here to tell you. We're gonna leave it just like that. But Mama signed off on it, and I gave her opportunity to really do her own research because she don't play around when it comes to her babies.
That's right.
And with that being said, she is all in, and we're going to make it a family affair. As a matter of fact, I'm probably going to get my booster at this event as well.
Oh, fantastic. I'm looking forward to getting mine as well. So as we wrap up, I know you mentioned the event that's happening this Saturday, as well as inviting everyone to get more information from there instead of going to social media. So can you let our viewers and our listeners know where we can get information? Maybe there's a contact number or website or something like that.
More than happy to. Again, we have a dedicated team of professionals that I am so grateful to be affiliated with. The Durham County Department of Public Health is filled with 250 plus men and women who are fiercely committed to protecting and promoting good, healthy behaviors for Durham County. We do have a hotline in which you can go to, which is 919-560-9217. Again, that's 919-560-9217. We do have people standing by who are able to answer your questions and schedule appointments. But of course, our website, www.decopublichealth.org, is your one-stop shop for all your information you need in terms of overall public health, but particularly there's a definitive section on COVID-19 that has so much information. And, we are committed to making sure that Durham has the information they need to continue to keep us safe and keep us really on that trajectory to move towards some semblance of normalcy. But you must do your part. Please consider getting vaccinated, consider your booster, and please consider your pediatric vaccinations, as it is there and it's here, it's free, and it's available to you.
There you have it. It has been a pleasure to meet you and to hang out with you and to get so much vital information. Mr. Rodney Jenkins, thank you so very much. The Health Director of Durham County Department of Public Health. Like I said, I am proud of my city. Y'all keep up the great work.
Indeed. Thank you for having me.
God bless.
Hi, this is Karen Clark from Foxy 107, 104, and I am here, part of our town hall with Duke Health about COVID-19, and specifically today we want to talk about the kids. So I've got Dr. Kalu here. Thank you for joining us. Now that vaccines are available for children, everybody has questions. Like, they had questions before, but now we have questions before we go and give our babies this vaccine. So hopefully you'll be able to soothe some concerns and get some information out there that parents really want to hear today. Okay.
Awesome.
So what we want to start with is what vaccines are available for the kids from the different brands and the different age brackets. How does that all work?
Yeah, so thanks for having me today. I'll try and keep it short and sweet,
okay.
Because I know there's a ton of information out there. So first of all, the groups that we talk about in terms of categorizing vaccines available for kids are those greater than age 5 as of today. That being said, maybe in a few months, we might talk about the actual babies, so those that are less than age 5. Currently, just based on the timeline of their submission, we have Pfizer vaccines available for 5-year-olds all the way to, at this point, actually 16-year-olds.
Okay.
And that's because those are the groups that have been authorized. Over 16, you have an approved vaccine. That's the Pfizer vaccine. It's approved for 16 and over in adults. And then over 18, you have Moderna and J&J. These are based on the timeline of submission and also how the FDA has reviewed the data, but ultimately they're all safe and they all work. They have a few side effects that we've talked about, but they all work really well.
Okay, so let's talk about side effects, because I know that people have heard things in the news. Well, first, what are the benefits and what are the side effects? And do you feel as a pediatrician that the benefits outweigh the side effects?
So absolutely. I'll answer the latter question first. Today I'm in the hospital currently, so I still see children that had no medical history. They have been otherwise fine all of their lives, and they're coming into the hospital either with COVID, so the actual infection, or they get COVID, and as the kids have been doing, they've been fine. They get a mild cold, or they have no symptoms. But a couple of weeks later, about 3 to 4 weeks later, they're coming in with post-COVID syndromes. And that's concerning. I know the babies have been okay. They've kept up with masking. They've gone to school. They've stayed away from their friends. They've done what they can, followed all these instructions for almost 2 years, and they've tried to be safe. But we're still seeing pockets of kids that are coming in really sick, and we're still seeing spread. So the risk of getting COVID exists, and head to head, getting the vaccine is still a lot safer than getting COVID, either the first infection or the post-COVID syndrome that we still don't even know how long that's going to last. But you're right, there are a couple of side effects, and we have to discuss them. You have to talk to your provider about this. One key one for the Pfizer vaccine has been this risk of heart inflammation. So having the terminology you might hear is myocarditis. It's just inflammation of the muscle, or pericarditis, inflammation of the surrounding tissue around the heart. The risk is really rare. We found out pediatricians picked this up first. They said, something's a little strange. We know kids get heart inflammation after viral infections. They get it after COVID, and a lot more of them get it from COVID than from the vaccine. But at the population level, when we vaccinated millions of kids, they found a couple tens initially, then a few hundreds that developed this rare side effect. It usually was picked up with a low fever, maybe some shortness of breath, maybe some chest pain, and it resolved in a day or two. I still think if your child has any heart condition, you should sit down and talk with your provider. But that rare side effect is so rare, and I'm more afraid of COVID. That's a little bit more common right now happening. So I would still suggest getting the vaccine.
So the numbers are on our side. If we're concerned about the heart inflammation, the numbers are on our side. That's probably something that's not going to happen to the vast majority of kids.
Absolutely.
Okay. So let's talk about long-term COVID or long COVID with kids, which I know is hard because COVID is still new to everybody. And so it's not like we can be like, oh, 10 years from now, they're going to be like this. But what does long COVID look like in kids? We've been hearing stories about adults that are just experiencing all kinds of stuff like, just extreme fatigue and oxygen and all of that. Is that what it looks like in kids as well?
So far, we've seen far fewer cases of long COVID in kids, and that's good. But we also know that kids react differently to both the virus and to the environment around them. And so in general, when we've seen long COVID, it may be something as simple as the loss of smell and taste doesn't really come back, or these kids are having changes in their ability to go to school. And the reason why we have to use something like school is that's probably the most taxing thing you expect a child to do. You expect them to show up and concentrate in school for a couple of hours. And even a child that has been doing fine for years suddenly starts to slip a little bit, you have to think through what might be causing this. And it takes a while to pick up on the reasons for having some slips in education because, it takes a while to get through the exams and go to school for months. So we're now starting to see a cognitive change in some kids or something about their nerves changing over time. Again, because this is post-COVID, it's long COVID, the virus itself is kind of out of the system, but we're dealing with the damage that the virus has done. The vaccine doesn't do this type of damage, and that's why, going back to the last point, I would not take any chances with COVID causing long-term syndromes, which we're starting to see in kids as compared to, say, the vaccine, where you can get it and you're done with symptoms in a day or two.
So what about parents that are listening to this and they know that the vaccine is available, but they're like, I just want to wait and see. This is my baby. I'm not taking any chances. What do you say to those parents, and where can they get information that they can actually believe and trust, not just Facebook? Where can they get reliable information so while they're waiting and seeing, they've got information they can read?
So I say to those parents, I hear you that, yes, You have a point, you want more information, and you should get more information. The quick places you can go, you can start with the CDC. So the CDC pushes out summary information about vaccines, and it's usually in terms that anyone can read and understand. But if you still have questions, call your provider's office. They all should have access to information at this point. You don't even have to set up a visit. They can send it to you electronically. We're in North Carolina, so our state health department has also summarized all the data that's available and put it on their website. And also the American Academy of Pediatrics, AAP, has a ton of videos, has resource documents that are available. I work in a hospital, so I'll put it out there. We have data. We can talk with you. My email, my phone numbers are available for parents that have reached out, and more than happy to talk with parents directly as well.
Now, I know during all of this, you've been just out there and very vocal and very visible about sharing this information with parents, especially in communities of color. Why do you think it's so important to talk to the communities of color?
Because I always say, first of all, kids are my communities. That's my first group. And then these are across each group. So communities of color, international communities, immigrant communities, any community that has been disproportionately impacted. That's my community. I want to live in it and I want to speak to people. And the reason for that is we've looked at, you can slice the COVID numbers any way you want. You can look at it as cases, deaths. You can look at it as even just social impacts from COVID. And it continues to hit our communities of color harder for a number of reasons. But we can change that, and we have to change that. We cannot continue to see this disproportionate impact for a long time and sort of sit and wait to see if someone else will come and help us. We're fixing this ourselves. And so I keep pushing for anything that can save even one child, because I don't want to see that one child end up in the hospital from COVID. And to be fair, when we look at our case counts, Durham and Wade, just around the triangle area, both for COVID and for MISC, so multi-system inflammatory syndrome in children, it's a post-COVID syndrome. We're seeing higher rates in communities of color, kids of color, and I want to change that.
And that's still with kids that have no medical history?
Yes. So at baseline, there are some kids that have ended up here because they have a past history of some medical disorder, or they have a history that suggests they will do worse with COVID. But it's something as simple as asthma and obesity. We have a lot of kids that may be dealing with that on just a typical day, and usually we don't see them die from it immediately, and now it's causing worse disease. But then we have about 30% of kids that end up in the hospital or have MISC that have nothing. They've only had routine care. They've had no history of a medical condition, and they still end up in the hospital.
That is terrifying. As a parent, that is absolutely terrifying. Now, what about parents that are like, this is too new, I don't trust it? Can you break down simplistically science that makes people understand, like, this was not just something that came out of the blue and they're like, okay, let's shoot it in little kids' arms or even the big kids. Can you help us understand that a little bit better?
I'll do my best. I'm working on taking the science out of the hospital a little bit more. So even in the last week, for example, so for parents that want to wait and see, in the last week, in the United States, we've already provided vaccines to almost 1 million children 5 to 11 years of age. So already you are having a ton of data to help inform that wait and see approach. And so in about 2 or 3 weeks, you have waited and you would see if we pick up on anything. Most often, and we've had vaccine data for almost 100 years. When you see anything related to a vaccine, you see it in the first couple of days, at most couple of weeks after vaccination. Viruses can mess with you for years. Vaccines, they don't last that long. And this technology has been in the works for decades. So nothing about this is actually new. The vaccine itself is relatively new, but the technology has existed. They tried it for Ebola. They tried it for SARS-1. This is SARS-CoV-2. We had one about a decade ago. So we've had a chance to try these things. But all those epidemics did not mess with us as much as COVID has. And so in the past year, everybody was working on the same thing. And that is what has led to us having many options for vaccines. And so we used all of the typical safety measures to test this in adults. They always start in adults, tested in older children, and then they did a dose check. So they didn't just use the same dose. They figured out what dose would be safe for this growing immune system that would still protect them. And that's how we ended up with a third of the dose for Pfizer vaccines. So in summary, lots of work, everything safe. They didn't speed up that process to make the vaccine for kids. And ultimately, the options we have right now, which is really just Pfizer vaccine for kids that's the youngest age 5, is safe and it works.
Okay. And one last question, because this is something that I hear a lot. I've seen it on social media a lot. I have a couple of girlfriends that have even said it. I don't want to get the vaccine for my kid because I don't want it to affect their fertility. Can you address that?
Yeah, I can. This started with a random internet point. I tried to track this to the beginning just to figure out where the science question came from. And it seemed there was some concern that some protein in the placenta could be attacked by the vaccine, which doesn't exist. So none of that actually exists. The vaccine is just that short list of instruction that's in the mRNA. mRNA is literally like something that's stamped that's arriving to your house, and it's a read and delete letter. Your body can only read it and delete it. There's nothing else that can do in your body, and it disappears completely. To the point that even when we run trials, they tell people you're in a trial, you are not allowed to get pregnant. And still, a bunch of them got pregnant anyway because humans are humans. So there is no data, there is nothing in this vaccine that has any way to impact fertility. All of the ingredients are available publicly. They have some stabilizers. So the mRNA, that instruction, read and delete instruction, your body gets rid of it as soon as it makes your protective antibodies. And then some stabilizers, salts and sugars and buffers. They changed the buffer slightly for the younger kids so the vaccine can be stored in the fridge for weeks as compared to that super expensive deep freezer that people had to get.
Right.
It does not, your kids will have babies if you want them to. Hopefully they wait till they pass the young ages, but this vaccine would not be a reason for them not to have kids if they want to.
All right. Well, thank you for addressing that, because I for some reason this seems like the internet rumor that has just gotten legs and is running track around social media. So I really appreciate you discussing that, and I appreciate you talking with us again today. Thank you. And now it's back to Melissa.
First of all, we know right now that our kids ages 5 to 11 can now get vaccinated against the COVID-19 to better protect themselves as well as those around them against this pandemic. Now, one of our main concerns and questions as parents revolve around our kids returning back to school and returning safely. Well, here to answer some of those questions is Chief Operating Officer of Durham Public Schools, Mr. Julius Monk. How you doing, Mr. Monk?
I'm doing well, Melissa. Thank you for having me.
Thank you so very much for joining us today. So let's just go ahead and dive right into this. When it comes to our kids in school and COVID-19, us as parents are like, yes, we need answers. So COVID-19, we know, has impacted our communities as well as our schools. Now, if a COVID cluster pops up at a school, how does that impact the school's ecosystem as well as, the health standpoint as far as education wise too, the health standpoint as well as the educational standpoint?
Certainly. Thank you for that question. I'm glad you led with the community because our schools are definitely a part of the community. Our families and students come from the Durham community, and we believe that we're truly in this all together. And so when we have multiple cases at a school and it becomes considered a cluster, we may have to shut down several classrooms. And then our students, and this is particularly important for our 5 to 11-year-olds who up until last week hadn't been able to get vaccinated, they will have to go home for 10 days. And if another case popped up and there were close contacts in that classroom again, they would have to repeat that cycle again. So you can see that you don't really get that good consistency. There's constant interruption to instruction whenever those types of situations occur, and we have to close classrooms. Now, but most importantly, we want to make sure that our students are healthy and safe whenever they're with us. And so that is paramount to us. And so we're concerned for our students whenever they are away from us, whether they are infected with COVID-19 or even making sure that they have a healthy meal to eat during the day. So all of those things weigh heavy on our minds whenever we have to make those decisions, whether or not we're going to close the classroom. And it's not a decision that we take lightly, but we want to make sure that we keep our students safe, keep the families that they go home to in the community safe, and keep our teachers and staff safe.
Yeah, so many decisions you all have to do to make sure that our kids are safe when they're away from us. Now, look, now that the Pfizer vaccine for ages 5 to 11 is available, how would having an increasingly immunized student population impact the well-being of everyone within the school system, having everyone immunized from those ages?
So this is exciting news for us in education. We had something very similar that was exciting whenever our adults back in the spring were able to get vaccinated, and then we weren't having to go into quarantining for our staff before kids came back. And then the excitement grew later on whenever 12 and up were able to get vaccinated, and in particular with our sports and arts, where they have more contact with one another. But when they're vaccinated and it's a close contact and they're wearing the mask and they're not feeling symptoms, you don't have to do the quarantine. And so you don't have that constant interruption into instruction and into their lives. So we believe that this is truly going to be a game changer when our families take full advantage of the vaccination for 5 and up, and keeping those students in the classroom. When you think about the age of 5, I mean, that's kindergarten. That's when they're learning not only about the ABCs, they're also learning how to work together in a community. Because up until that time, it's your family that's teaching you. It's those closest around you that you've been exposed to. But when you come to school, you learn about so much more. You learn about how to be a community member and to be cognizant of one another's health and space and other things like that. And so we don't want our kids to miss out on that. And vaccination, we believe, is going to be one of those things that are that's going to get us back as close to normal as possible.
Yeah. Like you said, it's a critical time for our kids, especially at 5 years old in kindergarten. And that leads me to my next question. What impact can the vaccine have on a child's ability to get a solid education? What impact could it have for their future goals in general?
Every minute of the day we spend is how do we educate our students and provide that personalized learning for them. And when they're not in class, though, and they having to learn asynchronous at home, they don't have that one-on-one contact with our wonderful educators that we have here in Durham Public Schools. And so getting that vaccination keeps them in school. It keeps them healthy, even when they're away from school, right? Whenever they have birthday parties and amusement parks and doing all the other things that children like to do to enjoy life. And so we believe that this is how we get back to educating our youth, and this is how they get back to enjoying life all around.
Yeah. Now, you mentioned earlier something, about sports and being vaccinated and the opportunities with that. What about opportunities like that, like the field trips, the sports, the group activities, or the extracurriculars? Do you think that a child's immunization status could impact other enrichment opportunities? And why does this matter?
Absolutely. When people aren't immunized or vaccinated, then they have to be quarantined. They have to be isolated from other people. Public education, schooling is a congregate type of activity. We come together. Lunch is together. PE is together, Right. And so anytime someone has to be isolated or quarantined, they are away from that togetherness. And so it is so important for our children to be able to go on a field trip. You know, one of the things I look forward to most whenever I was in grade school was going on those field trips.
You and me both, yes.
Yeah. And sometimes it may be to Busch Gardens, sometimes it may be to Washington, D.C. And sometimes that's the only time our students have that break, that opportunity to go experience and see for themselves what they didn't read in books. And so whenever we get vaccinated, that's the faster we can get back to doing those things.
Right. That's absolutely wonderful. And that's what we want and what we need for our kids. Now, the population of students and teachers and staff at Durham Public Schools is very diverse, representing various historically marginalized communities. From a health equity standpoint, why is it important that such student populations are protected against COVID-19?
So, as you said, Durham Public Schools is 81% students of color.
Mm-hmm.
And so those students should not have any reason why they don't have access to this vaccination. I mean, that is the overwhelming majority of our student population. And certainly there is hesitation amongst, we saw it early on in the pandemic, whenever the vaccination first became available, hesitancy from adults of color, to get the vaccination for historical reasons. So there's context around those things. I would say, though, that I am a believer in science and as well as history. And I think that it's only fair that we ask the tough questions of those who we entrust our care to. And so I think it's fine for people who are hesitant to ask those questions and to get some sense of understanding of what this vaccine is capable of doing, and even of the side effects. And that's why prior to us having vaccination clinics, we've been doing town halls for parents to come and learn more, not only for their child, but also for themselves. So if they don't have it, so they can learn more and become comfortable with it. And when we have that clinic Saturday at Hillside,
right,
you know, we're not only vaccinating students, mom and dad, uncle, grandpa, everybody come. Get your first shot, your second shot, your booster shot, get all the shots, so that the next time that we gather at Hillside and some other places, it'll be at a basketball game or a football game or a play or something like that.
Now, this event that's happening is Hillside. What time does it start for those? Since we're just kind of kicking off right now, I know a lot of people are saying, what event at Hillside on Saturday?
Yeah, it starts at 10. And we're asking people to register ahead of time. And I'll make sure I don't know all these emails and things off the top of my head, but I'll make sure I get you information so we can put it out.
Great.
We're asking people to register ahead of time, but walk-ins are definitely welcome to come as well.
And they will be eligible to get their vaccination for their child as well as their boosters during that time?
Absolutely.
Great. Well, Mr. Monk, you have been a plethora of information. At the very end, I want to ask you, at the end of the day, when it's all said and done, what is your biggest message to the parents? You've already said that, we as adults were reluctant to get our shots. Now it's our kids' time. What do you want the parents to know? What do you want them to take away from this and to think about?
So I wouldn't ask you all to do anything that I wouldn't do myself. I'm vaccinated. My wife is vaccinated. My 14-year-old son is also fully vaccinated. And on tomorrow, we'll be taking our 10-year-old, recently just turned 10-year-old, to get his first shot of the COVID-19 vaccination. And we're doing that to protect our family, to protect our community, and to ensure that he's going to have an opportunity to go into school and to stay in school. So this isn't just a job for me. It's something personal for me because it impacts my family as well as the families that surround me. And I also like to say, even beyond the COVID-19, it's also flu season. So please get your flu shot as well. And any other types of immunizations that you may be behind on, make sure that we're getting that so we're all staying healthy and safe so that we can enjoy life and enjoy the Bull City.
Absolutely, the Bull City. Well, Mr. Monk, as we kind of wrap up here, you're the Chief Operating Officer, Durham Public Schools. You have a lot on your plate, a lot to do, but I know you're inviting everyone that if they need information or want information, that they can contact someone there. Can you give us some, maybe a website or a telephone number that those that are listening or watching right now can maybe contact y'all directly with a question that maybe wasn't answered at this time?
Absolutely. Visit our website, www.dpsnc.net.
Great.
And you can also give us a call at 919-560-2000. And whoever answers the phone, we will get you to the right place.
Absolutely. Sounds like you're going to take great care of our parents as well as our students. And thank you so very much, Mr. Monk, for coming on and sharing all this wonderful information. As parents, we're concerned about our kids being at school, but it sounds like you've got them covered.
Absolutely. Thank you for having me.
Thank you. And thank you all once again for joining us for our Radio 1 Children's Vaccination Campaign. This is not it. I want you to stay tuned because right now I'm going to throw it over to my colleague, Karen Clark from Foxy 107-104 with more information, questions, and answers for you. Until next time, grace and peace.